Okay, so you sent in a ton of info about this connection between obesity and diabetes, and importantly, how to actually deal with both of them, how
Right.
to manage them.
It seems like you've really done your research.
Yeah, you have. It's really a comprehensive collection of information.
You've hit on some key themes, I'd say,
Yeah.
like how prevalent obesity is in diabetic patients.
Right.
And there's this shift in thinking about obesity as, you know, not just a risk factor, but like its own chronic condition.
Right. Exact.
And of course, the impact of weight loss,
Yeah.
even a little bit of weight loss can be so beneficial.
Right.
And then, you've got a whole range of treatment approaches here.
Yeah.
Lifestyle changes,
Right.
medications, and even surgery.
Right. Exactly. So we're going to try to get to the heart of all of that
Yeah.
for you in
Yeah.
this deep dive. We're going to pull out what's important and give you a clear, understandable,
Right.
and actionable picture of this whole relationship between these two things and what you can actually do about it.
I think that's a great goal.
So let's just jump right in.
Yeah.
Maybe we can start by just talking about the link between these two things.
Okay.
How strong is the link between obesity and diabetes?
Yeah, it's very strong.
Yeah.
The numbers are pretty striking, actually. It's pretty consistently pointed out in all the sources you sent that over 90% of people with diabetes
Wow.
are also living with overweight or obesity.
That's huge.
Yeah, it is huge.
Why do you...
And one source even goes a little further to say that over 90% of individuals with type 2 diabetes
Right.
have a BMI of 25 or higher.
Wow.
So yeah, it's a big, big majority there.
Yeah. And I've also heard this term diabesity.
Right.
What is that exactly?
Yeah. It's basically saying that, someone's diabetes
Yeah.
is very closely tied to their obesity.
Right.
And that, these two conditions are so interconnected that often,
Right.
you address one and you're going to see an impact on the other.
Right.
So it's kind of two sides of the same coin in many cases.
Yeah, that makes sense.
Yeah.
But one of the sources also made this really interesting point,
Oh, okay.
that while obesity is a major risk factor for type 2 diabetes,
Mm-hmm.
it doesn't necessarily directly cause it in every case.
Right. That's a really important distinction.
Yeah.
Obesity, it significantly increases your likelihood
Yeah.
of developing type 2 diabetes,
Right.
but it doesn't guarantee that you're going to get it.
Right.
One source even suggests that, between 80 and 90% of adults with type 2 diabetes
Okay.
also have overweight or obesity.
Wow. Okay.
So it's a huge, huge risk factor.
Right.
But it's not a guaranteed cause and effect.
Right.
There are other things, genetics,
Yeah.
lifestyle,
Sure.
environmental factors
Of course.
that all play a role as well.
Okay. So how does obesity lead to that increased risk?
Okay.
What's actually going on in the body?
The main way is through what's called insulin resistance.
Okay.
And essentially what that means is that obesity makes your body less responsive to
Yeah.
insulin,
Right.
which is the hormone that regulates your blood sugar.
Right.
So there are a few different things that contribute to that.
Okay.
Having increased levels of free fatty acids in your bloodstream can mess with how insulin signals to your cells.
Okay.
Obesity also triggers the release of these inflammatory cytokines,
Mm-hmm.
which are like little signaling molecules in your body.
Okay.
And when they're in excess, they can actually interfere
Yeah.
with how well your cells respond to insulin.
Right.
And then also, obesity changes the production of adipokines.
Okay.
So you can kind of think of your fat tissue as not just like a storage depot,
Right.
but also like an active organ that releases hormones.
Right.
And these hormones are called adipokines.
Okay.
And when you have obesity, the balance of those hormones gets disrupted.
Yeah.
And it makes it harder for insulin to do its job.
Right.
And finally, obesity often leads to less physical activity.
Right.
And when your muscles aren't working as much, they don't need as much glucose.
Right.
So that further contributes to insulin resistance.
That makes sense.
Yeah.
So we're mainly talking about type 2 diabetes.
Yes.
What about type 1?
So type 1 diabetes is an autoimmune condition
Right.
where the body's immune system attacks
Mm-hmm.
and destroys the insulin-producing cells in the pancreas.
Right.
So it's not directly caused by obesity.
Yeah.
However, people with type 1 diabetes can still develop insulin resistance
Okay.
if they have overweight or obesity.
Okay.
So managing weight is still important,
Yeah.
even if you have type 1
Of course.
for overall health.
Yeah. So we've established a strong link.
Yeah.
Why is this such a serious issue? It's
Mm.
more than just the challenge of managing two conditions, right?
Yeah, it's a really big deal.
Yeah.
Your sources highlight that having both obesity and type 2 diabetes
Yeah.
can significantly shorten your life expectancy and affect your quality of life.
Sure.
And the financial cost, I mean, the cost to the healthcare system
Yeah.
is substantial.
Yeah.
One source mentioned that back in 2002,
Oh.
the estimated cost of diabetes in the U.S. was about $132 billion.
Wow.
And overweight and obesity added another $122.9 billion to that figure.
Oh my gosh. So together,
Yeah.
well over $200 billion.
Yeah.
And I'm sure that's just gone up since 2002.
Oh, absolutely.
Yeah. And that's just the financial cost, right?
Right.
What about the impact on health?
Well, obesity kind of acts like a multiplier.
Okay.
It can make a lot of health problems worse.
Sure.
And then these become extra conditions on top of diabetes.
Right.
Your sources list quite a few,
Okay.
like high blood pressure, unhealthy cholesterol levels,
Yeah.
osteoarthritis,
Wow.
depression,
Wow.
sleep apnea, reactive airway disease, fatty liver disease,
Okay.
acid reflux, hormonal issues,
Yeah.
even things like urinary incontinence.
Really?
Yeah, it's a long list.
That's a long list. So how do doctors diagnose obesity in someone who also has diabetes?
Well, the standard first step is calculating BMI,
Ugh.
or body mass index.
Right.
And it's a measure based on your height and weight.
Yeah.
And there are established cutoffs for overweight and obesity.
Okay.
And it's important to remember that for people of Asian ethnicities, those cutoffs are lower
Okay.
because they tend to carry more body fat and face increased risk even at lower BMI numbers.
Yeah, I did see that in the sources that there were different numbers for different groups.
Yeah,
But it sounds like they're looking at more than just BMI these days.
that's right.
Right.
Yeah,
They're taking a more holistic approach.
Yeah. So the AACE and ACE, the American Association of Clinical Endocrinologists,
Okay.
and the American College of Endocrinology
Yeah.
recommend also looking at your overall metabolic health.
Okay.
So think of metabolic health as a snapshot of how well your body manages things like blood sugar, cholesterol, and blood pressure.
Right.
Ideally, those markers are all in a healthy range.
Okay.
And then for folks with a BMI in the overweight range,
Okay.
but not quite obese,
Yeah.
they recommend also measuring waist circumference
Okay.
to get a better sense of the risk associated with abdominal fat.
Right.
And there are specific waist circumference numbers
Okay.
for U.S. and Asian populations that indicate higher risk.
So it's really more than just the number on the scale.
It really is.
Okay.
One source even talks about staging obesity
Okay.
based on the presence of other conditions
Right.
and how much those weight-related issues are limiting someone's abilities.
Okay.
So that's interesting.
That's interesting.
And then all of your sources
Yeah.
emphasize the need to calculate BMI annually
Okay.
and to screen for those related conditions in overweight or obese patients.
Yeah. Catching things early
Yeah,
is always better.
absolutely.
So let's talk about what can be done. What can we do? Weight loss seems to be a really important part of it all.
It's a cornerstone, I think.
Yeah.
You know, multiple sources are very clear about this.
Okay.
Weight loss
Mm-hmm.
slows down the progression of diabetes complications.
Okay.
That's really key.
Yeah.
Even small amounts, like 3 to 5% of your starting weight,
Okay. So not a huge amount.
not huge, no, can lead to improvements in blood sugar,
Okay.
improvements in A1C levels,
Mm,
slow down the development of complications,
right.
reduce how much medication you might need,
Okay.
and even prevent prediabetes from turning into type 2 diabetes.
Wow. So
Yeah.
even a little bit
Even a little
can
do.
make a difference.
Absolutely.
Okay.
And then the general recommendations aim for an initial weight loss of 5 to 10%
Okay.
because that's linked to an even bigger drop in A1C,
Right.
like around 0.6 to 1%,
Okay.
and bigger improvements in other health markers.
Okay.
Even a 2 to 5% loss can make a difference in your fasting blood glucose levels.
Mm-hmm.
And for people who have prediabetes,
Right.
the American Diabetes Association recommends aiming for a 7% loss
Okay.
of their starting weight
Right.
to help prevent type 2 diabetes.
So these numbers keep coming up again and again.
Yeah.
So I guess it's important.
Yeah, it is. And the benefits go beyond just blood sugar control.
Right.
Studies that have followed adults with type 2 diabetes over time
Mm-hmm.
have shown that losing even 20 to 30 pounds
Okay.
can lead to a 25% lower risk of dying from any cause
Wow.
compared to those who stay the same weight.
So pretty significant.
Yeah, it is.
Wow.
And then there's the Look Ahead trial,
Okay.
which was a big study
Hmm.
looking at the effects of an intensive lifestyle program
Okay.
on weight loss in adults with type 2 diabetes
Right.
and overweight or obesity.
Yeah.
And it showed a lot of positive benefits.
Mm-hmm.
You know, reduced sleep apnea,
Mm-hmm.
lower A1C,
Oh.
less medication,
Mm-hmm.
better mobility,
Okay.
quality of life,
Yeah.
fewer hospitalizations,
Wow.
and lower healthcare costs.
Lots of benefits.
Lots of benefits.
Wow.
And other research has shown that losing 7% of your weight and keeping it off
Okay.
can lead to improved fitness, smaller waist size,
Okay.
lower blood pressure,
Yeah.
better sexual function.
Really?
Yeah.
Wow.
And even fewer symptoms of nerve damage.
Wow. Okay.
Yeah, so weight loss is really important.
Yeah. So how do healthcare professionals guide people
Yeah.
through these changes?
So there's a model called the 5 A's.
Okay.
And this is for healthcare providers to use when you're
Right.
talking to patients about weight management.
Okay.
So first, they assess,
Right.
take stock of the patient's weight, health
Yeah.
status, readiness to change.
Right.
Then they advise
That's-
about the risks and benefits.
Right.
Then agree on some goals.
Okay.
Then assist in figuring out a plan.
Yeah.
And then arrange follow-up appointments.
Okay.
So that's kind of the framework.
Right.
And then there are different levels of support, too.
Okay.
Like
Yeah.
just getting advice from your doctor versus going to a weight loss program.
Right.
Doctors have to decide if they can provide the in-depth counseling
Yeah.
and the follow-up in their own practice, or if it would be better to refer the patient
Yeah.
to a high-intensity weight loss program.
Okay.
And the ADA often recommends these programs
Yeah.
for folks with obesity and type 2 diabetes.
Okay.
These programs usually involve meeting 14 to 16 times
Okay.
over a 6-month period.
Wow, that's a lot.
Yeah, it is.
So are these programs like in person or are they online?
That's a good question.
Yeah.
So the research suggests that in-person programs
Sure.
tend to be more effective
All right.
than online ones.
Right.
But both are better than no program at all.
Right, of course. And regardless of the program, follow-up is important.
Follow-up is really important,
Yeah.
at least every 3 months,
Okay.
to monitor blood sugar
Right.
and adjust medications.
Makes sense.
Yeah.
What about the specific techniques that are used in these programs?
So effective behavioral therapy
Okay.
involves several things:
Okay.
setting goals,
Right.
education about healthy eating,
Mm-hmm.
teaching people how to monitor their own weight
Okay.
and food intake,
Right.
developing strategies to overcome challenges,
Mm-hmm.
managing environmental cues,
Yeah.
behavioral contracts to reinforce positive changes,
Right.
stress reduction,
Sure.
addressing
Right.
psychological issues,
Yeah.
changing negative thought patterns,
Okay.
motivational
Mm-hmm.
interviewing,
Mm-hmm.
social support.
So it's really multifaceted.
It really is. It's not just about willpower.
Right.
It's about all these different factors.
Right. And are these programs easy to find and access?
That's the million-dollar question.
Yeah.
So Medicare does cover obesity screening
Okay.
and intensive behavioral therapy now,
Okay.
which is great.
All right.
But finding those programs in the community
Yeah.
can be a challenge. It can be
Yeah.
a real barrier.
Yeah.
But the guidelines also acknowledge
Mm-hmm.
that referring patients to commercial programs that
Mhm.
have a good track record
Okay.
can be an option too.
And you mentioned some of those
Yes.
in the sources,
Mhm.
like Weight Watchers, Jenny Craig,
Yeah.
Nutrisystem.
Right.
Do those actually work?
So there's evidence that both Weight Watchers and Jenny Craig
Okay.
can be effective for long-term weight loss.
Okay.
And Jenny Craig has
Yeah.
been shown to have benefits on blood sugar
Okay.
and a reduction in the need for diabetes meds.
Right.
Nutrisystem has also demonstrated significant weight loss
Okay.
and lower A1C in studies.
So they do work.
Yeah, they do.
Okay.
And then there's also the CDC's National Diabetes Prevention Program.
Right. Right.
And that's specifically for people with prediabetes.
Yeah.
It's based on this landmark study
Okay.
that found a 58% reduction
Wow.
in the risk of progressing to type 2. And the best part is Medicare started covering it in 2018.
Okay, so it's more accessible.
It is.
That's great.
Yeah,
So there are ways to get support,
absolutely.
even if it's not always super easy,
Yeah,
but you can find it.
yeah.
Okay, so let's talk about the science of weight loss.
Okay.
How does it work?
So the core principle is creating a calorie deficit.
Okay.
You have to burn more calories than you take in,
Right.
typically aiming for a reduction of 500 to 750 calories per day.
Okay.
And that's going to lead to weight loss over time.
And in terms of diet,
Yeah.
is there one specific diet that's best for people with diabetes?
Well, the research suggests that a lot of different approaches work,
Oh.
like low glycemic index,
Right.
low carb,
Right.
high protein, moderate carb,
Yeah.
low fat,
Mm-hmm.
Mediterranean.
Right.
As long as you're achieving that calorie deficit,
Right.
they're all safe for folks with diabetes.
Okay.
So it's really about finding something you can stick with
Mm.
long term.
That makes sense.
Yeah.
What about meal replacements?
Those can be helpful,
Okay.
especially for people who don't have a lot of time or
Mm-hmm.
find it hard to prepare meals.
Sure.
They can help with portion control
Right.
and consistent calorie intake.
Okay, so take some of the guesswork out.
Yeah, exactly.
So what about exercise?
Exercise is important,
Yeah.
but for initial weight loss,
Yeah.
diet is actually more effective.
Okay.
However, exercise is crucial for
Okay.
maintaining that weight loss.
Right.
The CDC recommends at least 150 minutes of moderate intensity aerobic activity each week
Okay.
and muscle strengthening exercises at least 2 days a week
Right.
for all adults,
Yeah.
including those with diabetes.
Okay.
And, even small increases in movement
Yeah.
can be beneficial,
Okay.
especially if you're not very active.
Right.
It's also something to be mindful of
Yeah.
for people who take insulin,
Yeah.
because starting a new exercise routine can increase the risk of low blood sugar.
So you need to be careful
Yeah.
and monitor your levels.
Right.
Okay, what about self-monitoring?
So self-monitoring is really valuable
Okay.
for both weight loss
Yeah.
and maintaining it.
Mm-hmm.
Regularly weighing yourself,
Right.
particularly daily weighing,
Yeah.
has been shown to help people stay aware of their calorie intake
Okay.
and support weight loss efforts.
So are you saying I should weigh myself every day?
It can be helpful,
Okay.
but, it's not for everyone.
Right.
The guidelines also recommend
Yeah.
keeping track of your physical activity
Okay.
and your food intake.
So like a food journal or something?
Yeah, exactly.
Okay.
For long-term weight maintenance,
Yeah.
the ADA recommends these ongoing programs
Uh-huh.
that last at least a year,
Okay.
with at least monthly check-ins,
Okay.
weekly weighing,
Mm-hmm.
and 200 to 300 minutes of physical activity per week.
So it's really a long-term commitment.
Yeah, it really is.
Okay.
It's not a quick fix.
No. It's a
Yeah.
lifestyle change.
Yeah, exactly.
Okay, so let's switch gears a bit and talk
Uh-huh.
about medication.
Okay.
What role can medication play
Yeah.
managing both of these conditions?
So medication management is really important.
Okay.
It includes adjusting diabetes meds,
Right.
but also considering meds specifically for weight loss.
Okay.
For blood sugar, doctors should think about options that are weight neutral
Yeah.
or might even help with weight loss.
Okay.
There are a few options,
Mm-hmm.
like metformin, pramlintide, GLP-1 receptor agonists,
Right.
DPP-4 inhibitors,
Yeah.
and SGLT2 inhibitors. And it's worth noting that combining DPP-4 inhibitors and GLP-1 agonists isn't usually recommended.
Okay.
It doesn't really add much benefit.
So are ways to manage blood sugar
Yeah,
without gaining weight
absolutely.
and in some cases even losing weight.
Right.
What about other medications?
Mm-hmm.
Like medications for other conditions?
Yeah, that's a great point.
Yeah.
Doctors should also review all the meds a patient's taking
Oh.
and see if any are associated with weight gain.
Right.
If possible,
Yeah.
they might reduce the dose
Okay.
or find an alternative,
Right.
like for certain antihistamines,
Mm-hmm.
steroids,
Okay.
some antidepressants,
Right.
beta blockers,
Yeah.
and most antipsychotics.
Okay.
So it's a holistic approach.
Right.
You got to look at the whole picture.
Yeah, that makes sense. So when might a doctor prescribe weight loss meds specifically
Right.
for someone with diabetes?
The AACE and ACE guidelines suggest considering it
Okay.
for patients with a BMI of 27 or higher.
Okay.
And these meds, along with lifestyle changes,
Yeah.
can improve blood sugar control
Right.
as well as helping with weight.
Yeah. So they're killing two birds with one stone.
Exactly.
So what are some of these medications?
So the FDA-approved meds for long-term weight loss
Okay.
include orlistat, lorcaserin,
Yeah.
fentermine-pyramate,
Mm-hmm.
naltrexone ibupropion,
Yeah.
and liraglutide. It's important for doctors to have a conversation with their patients about these.
Right.
What kind of results to expect,
Yeah,
potential side effects,
of course.
the costs,
Right.
all of that stuff.
Right. And what about those newer GLP-1 agonists that
Yeah.
I've been hearing so much about?
Those are definitely becoming more important
Yeah.
for treating both type 2 diabetes
Mhm.
and managing weight.
Yeah.
So you've got liraglutide, semaglutide,
Okay.
and tirzepatide.
Okay.
They work by increasing insulin release,
Okay.
suppressing glucagon,
Mm-hmm.
reducing appetite,
Yeah, okay.
and slowing down how quickly food leaves your stomach.
Okay.
And these are usually given as an injection.
Right.
They can be really effective,
Okay.
but they can also cause nausea, vomiting, diarrhea,
Right.
and there's a risk of low blood sugar,
Okay.
especially during fasting.
So those are things to be aware of.
Absolutely.
And tirzepatide, you said.
Yeah, tirzepatide has
Yeah.
shown really impressive results in trials. for weight loss.
Interesting.
What about surgery?
Bariatric surgery.
Yeah.
So that's an option for folks with a BMI of 40 or higher,
Okay.
or a BMI between 35 and 39.9,
Yeah.
who also have medical problems like diabetes.
Right.
And studies have shown
Mm-hmm.
that it can lead to remission of type 2 diabetes
Wow. Okay.
in many patients.
That's huge.
Yeah, it's not just about weight loss.
Right.
It's also about hormonal changes after surgery
Okay.
that improve blood sugar control.
It's pretty amazing that they can actually reverse the diabetes.
Yeah, it is.
So is it risky?
Well, it is a major procedure.
Right.
So it's important to carefully consider the risks
Yeah.
and benefits. It's not a decision to be made lightly.
So we've talked a lot about treatment.
Yeah.
What about prevention?
Prevention is so important. You know, preventing and treating obesity
Mm.
is a direct way to prevent and treat diabetes.
Right.
And it's all about encouraging healthy habits
Yeah.
from a young age.
Mm.
Right.
And for adults at high risk of type 2,
Yeah.
lifestyle changes are key.
Okay.
The DPP study
Mm-hmm.
showed a 58% reduction in risk
Right.
with a lifestyle intervention
Okay.
that included exercise, diet,
Mhm.
and aiming for a 7% weight loss.
Okay.
So those basic lifestyle changes
Right.
can make a huge difference.
Yeah. And it seems like managing both of these conditions
Mm-hmm.
often requires a team approach.
Absolutely.
Mhm.
Yeah. Your sources talk about the importance of an interprofessional team.
Oh, okay.
So this could include nurses,
Mm-hmm.
dietitians,
Mm-hmm.
primary care doctors,
Yeah.
specialists,
Right.
obesity medicine doctors, bariatric surgeons, pharmacists,
Yeah.
even therapists.
Okay.
And they all play different roles
Right.
in education,
Yeah.
treatment,
Mm.
monitoring,
Sure.
addressing comorbidities,
Right.
psychosocial factors.
Uh,
So yeah, it's a real team effort for
Yeah.
the best outcomes.
so we've covered a lot.